And just a reminder, this will be sent out. Attached to the recording is going to be a survey. We value your opinion as students and alumni here at WGU, so we are looking for your feedback. So if you would take the time, fill that out, greatly would be appreciated. Should take you no more than 2 minutes. So pretty quick and harmless. And if you want to go back and reference anything that's covered, I know that we're going to have some fantastic material. So feel free to go back and watch that recording. From here, what I'm going to do is I'm certainly going to stop talking and I'm going to pass it over to our moderator, who is one of our own here at WGU, Lisa Wagner. The floor is yours.
Awesome. Thank you, RJ. Welcome, everybody. It's so great to see a good turnout. I'm excited to have this platform and for career and professional development to offer us this platform today. I'm Lisa Wagner. I am the Director of Pre-Licensure Nursing for the Central Region here at WGU. I've been with WGU for about 8 years. Been in academia for about 10 years, and prior to that, 20 years in acute care. I started out as a bedside nurse in float pool, so learned a lot from that, and then worked some ortho, and then transitioned to labor and delivery. Finished the most of my career and got my certification in labor and delivery, and ended up a director of women and children for my last years in acute care before I transitioned to academia. So that's a little bit of my history. I'd like to turn it over to the panels. We'll turn it over to Dr. Wellington and let him introduce himself.
Hi, everybody. Good afternoon. Well, it's afternoon here where I am in Chicago, Illinois. I'm Dr. Zay Wellington. So I wear multiple hats, I will tell you that. I am the Director of Surgical Services at Lurie Children's Hospital in Chicago, Illinois. I began my journey at Duke University Hospital in Durham, North Carolina. I did my advanced study in pediatric hearts. From Duke, I went to the Medical University of South Carolina, where I did more study. I am a graduate of WGU in 2017, I believe. And what else do I do? It seems like my days are very occupied. I'm also the American Nurses Association president for Illinois, which means I'm responsible for around 250,000 registered nurses of Illinois, 112 nursing schools, around 1,128 healthcare facilities, which includes 44 magnet designated hospitals. I spent a lot of my time going back and forth to Springfield, Illinois, which is our capital, and Washington, D.C., advocating for certain things that we are in committee that we want to promote into law that reflects healthcare. And if that's not enough, I'm also an adjunct professor at Illinois College, where I teach community and population health. So thank you very much for having me on the panel today, and I'm very honored to be here.
Awesome. Thank you very much. And you have your hand in several things that does keep you very busy. I have questions already coming to mind that I'd love to inquire, especially about the legislation and involvement. So hopefully we can get to that today. I would next like to turn it over to Dr. I hope I pronounced this right. Is it Zumulinski?
Yeah.
All right.
Hi, everyone. Welcome. I'm Dr. Natalie Zamulinski. I have been a nurse since 1992 when I graduated with my bachelor's and started ortho neuro, did OB-GYN, then did gen oncology, and then probably year 7 got into labor and delivery. So I'm also labor and delivery background. Over the career, I decided at some point, someone told me, go get your master's. So I went to WGU, came highly recommended, and I totally just absolutely love the program. So I graduated in 2016 with my master's, and that started me on that journey of leadership. I was a manager at the time, became a director, was able to move into an ACNO, then a regional director, and I've been a CNO of a rehab hospital because I'm always pushing myself to do something different. And currently I am the director of 146 bed NICU in Houston, Texas at the Women's Hospital of Texas. And I have about 330 staff, and I just got my doctorate back in May. So
congratulations.
And then so I do a lot of work. I don't do as much as some of the others, but I do a lot of work with Texas. We do have perinatal and neonatal designation. So as a level 4 maternal and neonatal care, we do, I specifically love to do a lot of work with the state in our local, we call SETRAC, Southeast Texas Emergency Response. There are state guidelines that we have to follow and we have to work on to improve. So I've gone out with maternal safety, have spoken about implementing programs called Code Pressure. I've also gone out and have actually been doing national calls and other calls sharing PTSD screening, which I did a study here in our NICU and found about 60% of our NICU patients have PTSD. So I'm trying to do a lot of work now, really helping that side. So.
Wow. Interesting. Thank you so much. We do have a third panelist, Christy Jandora, who will be joining us. She is based in Florida. Right now, she's dealing with a little bit of a hurricane, so they're having an emergency preparedness meeting, but she does plan to join us in the next 15-20 minutes. So if you see her pop in, we'll probably pause at that moment and let her do an intro of herself. But right now, she's tending to things, matters at hand. So unless Christy, have you been able to join us?
There, yes.
Yay.
My apologies for being late.
No worries. We totally understand. If you don't mind to just do a little bit of a bio or intro of yourself, please.
Sure. Hi, I'm Christy Jandora, a WGU graduate and the Director of Emergency and Trauma Services for Ascension in the Panhandle of Florida. So we're just in a little bit of a hurricane zone at the moment, but we're doing great. I've been with this organization off and on for 30 years. I kind of grew up here as a nurse. I also serve on the Emergency Nurses Association. I'm the current president-elect for the state of Florida. I also serve on the National ENA Foundation Board for Scholarship Committee and Government Affairs. So I do a lot of advocacy work.
Awesome. Thank you so much. I'm excited to have three of you here today to share your journey, your expertise, information. We do have some questions, so we'll kind of dive in with those. If you feel like you want to respond, please go ahead and start responding. I won't wait to call on anybody. We'll just kind of have an open flow with things if that sounds good. The first question is, what are some key takeaways of your degree program from WGU that you carried into your career?
Well, I can speak from for myself for nursing and healthcare leadership. Some key things that really have stuck with me and I use on a daily basis was the leadership training, the healthcare economics training, specifically also the evidence-based practice and research training that you get through the program. It truly helps me on a daily basis with my job and my work with ENA.
Awesome. Thank you.
I think one of the biggest takeaways that I obtained and I still use is time management. As you know, at WGU, it's a competent-based system, flexibility, work at your own pace, and it really taught me now as the director, as my colleagues are, and working with students, working with legislature and the nurses of Illinois and the nurses of the United States, you know, the 5 million nurses that we serve, is how to manage my time, how to designate a plan to know how to make sure that my strategies are on point. I've developed a plan. I have time for myself and for the other, it seems, many things that we are all involved in. So time management and also mentorship. I obtained a mentor through WGU, who I still speak with today. I don't know if I should say her name. I'm sure she wouldn't mind. Her name is Danielle Weinberg, and we talk about things that inspire me. Some visions. She gives good feedback. She holds me accountable. So the relationship building for me was also very important.
Thank you.
I know the biggest takeaway for me, just to echo everything that they have already discussed, I'm going to kind of go a different way. Just how now I can impact change. I think when I got my bachelor's, it was more about bedside, the patient care, the science behind it. The master's degree from WGU really helped me see, okay, how can I impact change at the hospital? How can I impact the change of nursing, the department, that whole strategic thinking and leading projects and stuff that I've been able to put into practice every day, whether it's, we're building a new congenital heart program and we need to do X, Y, and Z, and let's do the timeline. What's our training? All the things that go into helping in your facility lead that project and also help at the bedside nurse. So to me, it was just really, those classes really helped with that strategic piece.
Awesome. Thank you. You guys really pulled out some key elements, and I think those elements can really help those that are just starting out in nursing who might be graduating with their RN. Time management is key, and it's really something to figure out as you're taking on that patient assignment. So I think that's key now, and it follows us through our whole career. As we go into change impact, change policies, different things for legislature, for even at our organizations. And I love the mentorship because I think that we're always mentoring. We grow professionally, so we're seeking mentors, and then we pay it forward and become mentors to those new nurses that are coming into the profession. I love those key components that you guys shared, so thank you very much.
And
How
if I
do
can
you
also
leverage?
piggyback
Oh, yes.
on something Natalie said,
Yes.
which is so important. I have to agree with Natalie. Relevant coursework. When I began my coursework at WGU, I in my master's program before I got my doctorate, the courses were designed to be which they were directly applicable to the career and real world experience that I was after. And I think I personally benefited from that, from relevant coursework, things that I would use in my job day in and day out, doing research, learning. And I'm glad that Natalie brought that up. I'm sorry to jump on that, but I think that's so very important.
I agree. Thank you. Our next question was how, the program advanced your career, but I feel like we kind of already touched upon that. Does anybody have anything else that they want to share about advancing your career and how the degree did that other than what we shared already?
I would just share, I think we did touch on it, just a little bit about my story with my current position. I graduated from WGU, and they give you the little owl that throws confetti for you to put on your social media posts. The day I posted that, my current employer reached out to me and said, I see you just finished your master's, and we are looking for someone with a master's level in your background. So that little owl put me in the seat I'm sitting in today.
Oh, that's awesome. I love that story. That is great. Oh,
That is a good
man,
story,
that's
Christy.
very powerful. So thank you for sharing that. That's good. And looking at leadership, as you all three are leading currently, what qualities do you think are very important in that leadership role?
Goodness, so many things come to mind. I mean, communication skills, relationship building, respect, vision, creativity, decision making skills, problem solving, innovation, being a thought leader. I think positivity, I think these are all important qualities that WGU prepared me for my leadership role.
I know, and thinking about that, I was thinking about the very first class, professional presence and influence. If you're going on the side of, I want to be a leader one day and not realizing you're always on stage. And that course really made me step back and look at, oh, wow, everything I'm doing, it's being watched. how I am in meetings, how I am around my peers, things that I say. So it kind of made me retrospect look and learn about the skills, the expertise, and really showing my passion behind everything that I do. So that course like stood out because I think all of that helps build you if that's where you want to go on that leadership journey.
Thank you.
I'll just say ditto to both of them.
I agree. With me being over the pre-licensure nursing program, I'm always telling the students when they go in for clinical, you're on stage. This is like a job interview. Present yourself so professional. They're looking at you, you're looking at them, looking at their culture on the unit. Is this somewhere you want to work? So we're always talking about professionalism from the very start and how it carries throughout our whole career. So awesome. Those are good things to share for sure. Any advice on how to transition from patient care to leadership is our next question.
I think the best advice I could give someone, it seems simple, but so true, is seek a leadership position that's not amongst the peers you've been working side by side with. I think the growth potential and the ability to adapt all of those relevant case or coursework skills that you learned, they're just easier if you don't do it amongst your best friends and peers.
Very wise
Yes.
advice. I agree with that. Sorry to interrupt.
No, that is very true because I had, in thinking about that question, I was like, I have been places where I have mentored up, being a mentor, someone who's within the unit, and they have a very hard time bridging that friendship. They want to be that leader and they're trying to make their, sometimes they're viewed as you're treating your best friends, and not to say leave your organization, but I think it helps you out beneficially and to push you to learn something a little different. And even if it's just another department, I think that's important.
if if I may do a shameless plug. So I wrote an article that was published last year. It's called From Buddy to Boss. And it was about you were a frontline employee, now you're the boss. How do you identify your strengths? How do you stay informed? You know, how do you stay focused on patient safety? How do you develop goals? How do you embrace change? Going from buddy to boss, you're a WGU, you've got your masters, you've grown with your own skills. I would say, not to plug A&A and A&A Illinois, but I would say join a professional organization. But definitely learn from workshops and collaborate with others and get a mentor and identify your own strengths.
Absolutely. Thank you. We're kind of going to shift gears and kind of look at well-being of our nurses. We've seen a lot. We've come through COVID, different things like that, and how healthcare has transitioned so much. There is an article out there by the ANA. There is an American Nurses Foundation that did some surveys back in 2023, and some interesting statistics just to share from that survey. 2 out of 3 nurses state that they're suffering mental anguish, are either not seeking or not receiving mental health support. 56 shared that there is a stigma as a healthcare provider associated with receiving mental health care. And 64% feel a great deal of stress because of their job. So let's kind of, look at those statistics, and let us start by each of you defining what wellness is in the workplace, your environment, and how you support your staff and your peers.
I guess I'll kick us off, but I do want to preface, I've been doing this, over 30 years as a nurse. So I have actually seen, I think a lot of us have seen the evolution of what's happened as a nurse. When I was a young nurse, if you were stressed and things were going on, everyone was like, be quiet. Don't say anything. Don't get on a medication. Don't let them know that you have a problem. Keep it a secret or you're going to lose your license. That used to be the stigma years ago. COVID taught me, I was seeing over rehab hospital during COVID, and it really made me shift gears. Before it was about, let's you're here to take care of patients, take care of your patients. That's the way it goes. You're a nurse, go. It's kind of like a football team. We're here, let's do it. It has taught me and shifted, and I'm so happy of the resources and the continued discussion that people are suffering. They're worried about their home. They're worried about their job. Did I do something right? Did I make a mistake? Everyone comes from a different background and a different way of being brought up, and we have difference in our generations of how they approach this. COVID taught me be empathetic, talk to my staff, know what's important to them, really connect with that family piece and understanding what's stressing them and how can I help out. I'm very honored where I do work. We have Optum Health. We have a counselor on site 3 days a week, and she's at another campus 2 days a week. So she's here all day. She will round in the units. You can set up private appointments, totally confidential. And I can tell you what COVID brought out, and I don't know if others can speak to this, is those nice relaxation rooms off the units with massage chairs, stuff like that, so staff can step away. So that's the biggest thing. And I think having the benefits of not going against nurses for calling in with stress or needing to send someone home, we're a lot more sensitive to that. So
I agree, Natalie. And those wellness rooms are a very inexpensive, easy way to set something up to allow your staff to step away. I think to answer the portion of the leadership question in it, as a leader, I try really hard to pick up on cues when I'm rounding on my departments or my staff. And I had one just yesterday who she just wasn't her normal, happy, bubbly self. And I said, "Hey, you got a second?" And I think it's okay as a leader for you to remind yourself it's okay to tell people, I recognize you're not okay, and pull them aside and what do you need? And you find the resources they need. They may just need a hug. They may need a cup of coffee. They may need a timeout in the wellness room, or they may need to go home for the day. And you have to recognize that, respect it, and offer resources to make them okay, because that's how you keep them coming back. That's how you build resilience. I work in emergency departments and trauma departments, so they're very high stress areas. And so it's super important that we recognize it. And then advocate. Of course, I do that with ENA in government affairs, but advocating for acts such as the Lorna Breen Act, which brings healthcare workers mental health resources. Being an advocate for like-minded professions is another way to not only give back, but also feed your own soul in the process.
Awesome. Thank you.
Agreed. And thank you both. We all know that workplace wellness refers to your mental, emotional, and social and financial health and the well-being. But to everyone out there that's in this crazy viral world that's listening to this, I'll say, a nurse, a healthcare provider, you are human first. You're human first. And we need to focus and we need to support each other in the workplace. You need your physical wellness. You need to eat right and exercise and get your rest. Take your time off. Be aware of your own mental wellness. I'm not a big supporter of this work-life balance. I don't think anything will ever be in balance. I would say, please have work-life focus. There'll be times when you work a lot, and there's times when you don't, but try to have a focus. I also, like my two colleagues, I would say, know who your support systems are. I would encourage that. Have peer support. You're human first. And I thank you for taking care of others and the wellness of others and being a nurse and a healthcare provider. But it's not easy to take care of somebody when you're not taking care of yourself. So please be mindful of your own wellness.
Thank you. Love the work-life focus rather than balance. I think that I love that. Do you mind if I borrow that? I think I want to share that with my
You
team.
certainly
So
can.
thank you. I love that. That puts a whole different perspective on it. And it's so true. It's hard to keep everything in balance. One seems to take over from the other, but having that focus, I love that. And then I love the nurse rounding, meeting them where they are. I think that means more to that bedside nurse because I've been that bedside nurse before. Having leadership come and check on me and recognize and giving me that space. I mean, I think that's just vital. You feel accepted, you feel appreciated and cared for. So I think that I love the rounding part of it and identifying that and picking up on those cues. So thank you all. Those are great, great responses. As we move to the next area, we focus on what barriers are nurses facing right now. Some of the barriers that we've pulled out from articles from 2022, the nursing crisis, challenges identified are unsustainable workload, inadequate staffing, ongoing work-life stress, which we kind of touched up on, and then burnout. Do you guys have anything to share? What strategies when you target like workload, staffing, anything innovative that you're doing out there with some of those barriers?
We
I'm
are
not sure.
learning,
Go ahead.
sorry,
No.
so we're just starting to um, grow specialty nurses. There is a definite nursing shortage out there, and especially of experienced specialty nurses such as ER, trauma, ICU, OR. So many different specialty areas that when I was first a nurse many, many years ago, you didn't get into those areas until you'd been just a bedside nurse for at least 5 years. And now we're having to take people right out of school and make them an ER trauma nurse overnight. And so really getting creative with your orientation processes, using resources from professional nursing organizations, um, asking your administrators to give you some grace on a 6-week orientation versus maybe they need a 6-month orientation.
Right.
And going back to mentorship, pairing them up with a mentor, a big sister, big brother, that they can not only rely on for expertise, but also rely on for that emotional well-being. So when the days are really hard, you can say, you know what, but you're still making a difference. You don't always win every day with patients in the ER, but you can win at your own mental health by knowing you did the best you could. And so those are just some of the things that we've done.
Awesome. Thank you.
Those are important. I mean, I try to always remember, we all have like ongoing work life stresses. Sometimes we're burned out and sometimes we have challenges. Um, I would say to remember and recognize that everyone is doing their best. Everyone's doing their best. Um, I would say manage Zoom and team meeting overload. Um, work on that work life focus. Um, don't be um, don't be afraid or don't forget to take your time off. You need time to recharge your battery. Um, as my colleague said, invest in personal development and professional development. Have open communication. Um, if you seek a mentor, talk about what's going on. Um, have an environment where you can share what you don't feel comfortable with. Give feedback about your concerns and um, to yourself. I would say set realistic expectations. Delegate when you can. Um, and show empathy to others. We don't know what others are going through. Like I said again, everyone's doing their best or is trying to do their best. People don't come to work to say I'm going to do a bad job today. People are coming to work to do the best they can do. So give them a safe space. Give a safe space to yourself and a safe space for others.
Thank you.
I know I know it's hard staffing for all of us, especially in the area that I'm in a very, like you were alluding to, the trauma, the patient population that our new nurses are You know, I was used to years ago, you have to build your foundation, med surg, before you go to the area. In our level 4 NICU, when I started here, we were 50 nurses short. And that sounds huge.
Whoa.
So we brought in 30 agency nurses, had a bunch of new grads. Everyone's like, you can't do this. They have a very structured program, but we were seeing a lot of burnout, a lot of turnover. You know, when they got close to that year, they're like, I can't do this. We have nurses that change the service line and they're like, I can't do this. So that made us go back and look at, you know, what's happening? What do we need to do? Because it's hard as a new nurse to go into any service line and have that support, because we've all been asked to shorten orientation. So we have now shadow. We bring people in and they shadow before, because I say an interview is a two-way street. You know, I want them to use all their senses, sight, you know, smell, listen, noise overload. And we're seeing that's helping. They come interview. If we feel they're a good candidate, we tell them wear scrubs, don't dress up. You're going to go in the unit and you're going to follow a nurse. You don't touch the patient, but you follow the nurse. So that's something we've been very focused on, to really look at our turnover, because, you know, I'm one of the blessed ones being in the Houston market. There's a lot of hospitals and there's a lot of nursing schools, and there's a lot of people fighting to get in my area. I got waiting lists. But I know there's rural areas and rural hospitals that are having, you know, those deserts of healthcare because there's no providers to take care of. You know, I don't have a solution for that. It's hard. But right now I'm really looking at how can I help the nurses have a successful experience. So if they do that and they accept the job, we give them about 16 weeks. We've upped and actually changed our program again, getting their feedback. And if someone needs a longer time, because to be in a level 4 NICU and learn ECMO and, you know, body cooling and all those things, and we have high death and we take 21 weekers and helicopters coming in and all that stuff. So it's a lot of stress, a lot of stress.
Awesome.
You know,
Thank you for sharing. Go ahead,
coming
Christy.
back to WGU skills, you know, it really helps when you do have those business acumen skills that you can go. When I first started this position, we had a lot of travelers. We were still in the thick of COVID, and putting together a business case showing the amount of money you spend on travel nurses versus taking those same resources and raising the pay of your current staff and investing in longer orientations or shadowing processes, you see it's actually a cost savings to invest in your staff, and it really helped to get our travelers out of here. So I'm proud to say, I love travelers, but I'm proud to say we don't have any now, and you learn those skills to help build that.
Thank you, Christy. And that's the next subject to kind of go into, but I would love to learn more about, with you showing the data, changing it to invest into your own internal employees, how did it affect the culture of the units of the organization?
It was a huge positive culture shift. Just to be very transparent, you know, ER nurses are very strong, like probably like Nick is very strong-willed, very vocal individuals. And so when they're working side by side with a travel nurse that's making double their pay, it's not a favorable culture to live in. And so just, you know, transitioning that and giving them more of their own staff. It also helped our staff take some ownership in growing these new nurses, because they knew it would get the travel population out and it would get them more financial compensation in the process.
Awesome. Anybody else want to share? Does anybody have like nurse residency programs? Something for those new nurses when they transition, for, you know, nurse readiness and how they're prepared throughout your organization?
So we have twofold. One is if they're in nursing school, we have nurse techs. So that way we found that having them come in and learn the different environments of the hospital, and we pay them to come in and learn, they have a lot shorter orientation and they're exposed to our culture and what we're here for. Our nurse residency program we have for all service lines, and it is very structured. They had just recently changed it back to how it usually was. Ours is 16-week nurse residency, but it goes for a year to 2 years. So they're going to do didactic. They're going to come to the unit, didactic, come to the unit for that 16-week period, come off. We have in-house what we call resource nurses, and they're specialized in that area, and they're able to come and follow them day shift, night shift, weekends, and they may not want to ask their peer, they may not want to ask their boss, but they'll talk to them like, hey, do you need me to help you with this? Do you remember how to do this? I'll help you give blood. Let's do this together. So they work with them for a year, and then it changes off to another one that's a little higher level that follows them for a year. So we really get them involved. They do projects, evidence-based projects and presentations in the units at the first year, do a big graduation, and then that next year we continue supporting them.
Wow, that's awesome. And I think that's so important in a time where we have such a shortage that we still invest. We really need to invest that time. And I love getting them involved, doing poster presentations, learning, especially about the quality on the unit. That gives them the why behind what they're doing in their practice. And we try to do that with our pre-licensure students here at WGU. In their last capstone, we pair them with leadership or quality so that they are getting that component of why do they do what they do at the bedside, to help ingrain that and to lead them more professionally in their career. So awesome. Thank you. Thank you. I do want
If
to
I may
shift
add,
to, yes,
sorry.
please.
I just want to say, amongst all of those things about phasing out our agency staff, which was a Band-Aid solution to some of the short staff that we were during COVID, but we've phased out that as well. Our nurse residency program has been fantastic. Our nurses that are nursing school that come in, but we also have an amazing program here in Illinois where other leaders personally go to elementary schools and high schools. And this year we had, I believe, over 500 or 800 people to apply for Discovering Healthcare Careers, which they came in and spent time with us at Laurie Children's Hospital. And saw what healthcare was all about. And I'm really excited to say that a student from that Developing Healthcare Careers decided to go to nursing school and was hired on to my team and my staff, is an amazing nurse. But it all began with someone investing the time with elementary and high school students discussing healthcare careers. On a personal note, myself, I don't think I'd be sitting here today if it wasn't a summer internship that all began at Duke University Hospital. I came from a very small farming community in North Carolina, first generation to go to school. I didn't know if I would get accepted. I went to this summer internship, was accepted at Duke, decided that I wanted to become a nurse. I later became a nurse at Duke, and it all began because someone invested in me. And so I think as a good leader, we're investing in our future. So having students and speaking to organizations and to high schools and going to career days and mentoring high school and elementary school students about what we do, it's very dynamic, and it's making a difference. And so just to piggyback on what they were saying, yes, we have a nurse residency program. It's for us, it's a year. It's going well. We have a mentorship program here at the hospital. It's going well. And we too have phased out our agency staff.
Awesome. Thank you for
Even though
sharing.
we're very appreciative of them that came in and helped us and supplemented us during some times when we desperately needed them. But obviously, it's not a long-term solution to staffing issues. So I'm very appreciative. But that addresses immediate staffing shortages, but it's not the way to solve your problems.
Right. It's not an ideal long term. There's a lack of ownership sometimes you see and things like that for sure. But it was vital during that time for us to survive and be able to
Sure.
provide the care for sure. Nursing is such a rewarding field, as you all have shared just through the different stories and different things. I can say myself personally too, it's just been rewarding step after step. And there's so many different avenues that nursing can take you into. It's amazing. Like, I can't say enough good things about it when I get the opportunity to speak to individuals at high school and career day and things like that. It's wonderful. So hopefully we can nurture more of that and bring more individuals into the profession. Let's talk about empowering our nurses.
Mm.
All the professional organizations, and that's one of the things at our pinning ceremony for pre-licensure, I always share and express: get involved, join an organization, take your certification exam in whatever area that you're specializing in, just to take that next step and be that advocate and do more. So please share about those organizations, what your thoughts are, encouraging our nurses to join that.
Well, please allow me to jump right in as the president of ANA Illinois. I certainly, I think this may be right up my avenue. Um, Scholarships, mentoring, a voice in legislation, leadership, education, grants, networking,
Mm.
working on your resume, professional organizations. They are really opportunities for seminars and training programs and conferences. And I can't speak highly enough about um, how these resources and connections can be great networks with other professionals in your field, um, and you can learn about new developments in the industry. So I'm a big believer in professional organizations. Yes.
100% agree. Well
Yeah.
said.
Thank
Well
you.
said. I like to say I now have 50,000 ENA friends from around the world, since it's a worldwide organization. And it just, on those days that you are starting to feel the burnout, or you might be working on a project that you just can't find the answer to, the networking and the collegial, atmosphere that these organizations bring helps you find the answers without recreating the wheels. I've been blessed enough to travel abroad with them to study socialized medicine and EMS care in Europe. Um, and I've done stuff with them right here in my own backyard. When you have things such as catastrophic hurricanes hit an area, those are the people that you can rely on that can help send resources and bring things to you for any kind of disaster. It's just one. I'll leave with one example is when COVID first was a thing. So we all take us back to early 2020. Uh, I was here in Florida. We received our first COVID positive patient, but I knew one of my ENA colleagues was running the ED in Washington State that had already been inundated with COVID. And I picked up the phone and called him and said, I need advice, anything you want to give me, any direction you want to give me. And it was just a plethora of very valuable information that let us safely start caring for patients without having to do a lot of the legwork ourselves. So,
Well said, Christy. There was no playbook for COVID. It's none. And as nurses, we're very like, this is the book. This is how you do this. This is your policy. This is your procedure. This is what we do. This is how and I too had a friend out on the West Coast where I said, teach us, what are some lessons learned? Um, we in Illinois are now, here we go. There's no playbook. What do we do? And that all stemmed from professional organization and from meeting colleagues, and building these professional relationships through American Nurses Association. So to ANA, I'll be forever grateful because they helped us to get a leg up of, all right, where do we go from here? And how do we serve these patients? And how do we keep ourselves safe? And how do we ensure that our families are safe. And what do we need to do? And so I have to agree with Christy. It all stemmed from professional organization, A&A.
I'd also say it's okay to be a part of more than one organization.
Yep.
Mm-hmm. Mm-hmm. I would agree with that as well.
I know I have ANCC, AONL, A1, NAN, all those organizations I participate in. Certifications are very, very important. I can tell you when I finished with my degree from WGU, probably one of the best things that you need to do is if you want to get your leadership certification, probably take it right after. I didn't. I regretted that, but then later on went back. It really helps prepare you for if you want to do your NEABC or your CENP, whichever direction you want to go, whichever organization you take the exam with is important in that leadership journey. Just like with A1 and NCC, their certifications, I've been able to take a couple. I'm looking at 2 or 3 more to get. It's not that I want more initials behind, but I think it helps better, what you're doing, the whole networking, everything, keeping you abreast. And then, just like hospitals, they focus on magnet, different things like that. So being part of organizations and getting your certifications, it improves what you're doing in the hospital. That's the biggest thing. You are of value to your organization, to your patients, the quality metrics, and patient safety.
I agree. I mean, I'm board certified. I'm a member of AONL, which is different from ANA. But I agree with Natalie that certifications show to employees that you are committed to your profession. You're committed. It shows to your patients you're the top of your field. So I would seriously say get certified. It separates you from other candidates if you're applying for a job. And certifications, also are associated with job satisfaction and career advancement. So, agreed. There's other organizations than ANA. I'm also I serve on AONL, Association of Nurse Leaders, and I'm also board certified. So, thank you for saying that. But yeah, I think you're muted.
Thank you so much. I was muted. I think we'll end there. We have more questions, but we're running out of time. This has been a great conversation. I want to thank all 3 of our panelists for great conversation, sharing your stories, your expertise. So we'll allow enough time for question and answers. I don't want to jip anyone if they have some questions out there. I do see one that came through the chat. It says, what leadership certification do you recommend and through which organization?
Well, if I may say, I would say, what area do you work in? I am a registered nurse, and that's my basis. But I am a nurse that works in the OR. So AORN, certification for CNOR is one that's highly sought after. It's not the easiest test, but it really proves you know your stuff. I'm also a pediatric nurse, so a certification in pediatric nursing. And as you get into leadership, as it was kind of echoed earlier, the NEBC or NEABC, Nurse Executive Board Certified, just proves that you have a commitment to the people you work for and you represent.
Absolutely. Thank you. Anyone else want to share on certifications and organizations?
I think just for organizations, AONL, if I can talk,
Yeah.
they have the CENP Certified Executive Nursing Practice exam, which is the same as the ANCC, which they have the Nurse Executive Board Certified exam, or the other one that they have. So I'm losing my mind right now. They're both great value. The only reason I took the one through AONL during Nurses Week, they had half price to get my, to pay for my exam and stuff like that. I can say if you are lucky enough to be in an organization that allows, we pay for the certificates for nurses to take their exam, and we give them $1,000 stipend once they pass it. So we're really trying to promote everyone to level, up their level in the OB world. I have my through NCC. I have my certification in electronic fetal monitoring and also my CONQS, which is a quality piece in the obstetric and neonatal world.
Awesome. Thank you. And I think I'll turn it back over to RJ at this point in time if he wants to, if I missed some questions in the chat.
So one question that did come in, I'm a nurse educator student. I'm an agency nurse. I don't work a staff position. What advice would you have for me once I finish school?
I think it would depend on short and long-term goals for you once you graduate. If it's to get into a hospital setting, I would say start connecting and making connections and friends with the hospitals in your area, whether it is that you just come to maybe some events they're holding. It could be hiring events. It could be community education events, like for orthopedics or bariatrics or things like that, where you could come and network and meet people. Or even volunteer at a facility that you're interested in working at, just to get yourself seen and known.
I think, like you said, whatever your career path is, if you want to do education, there's certifications in education component that you can get. If you want to go into leadership, WGU, their program really helps prepare you. If you do the master track in leadership and management, that really helps prepare you for one of the other exams for that leadership component.
I'd like to share too, WGU offers the postmaster certificate. So if you are doing the nurse education pathway, you can transition and do the postmaster certificate to do the nurse leadership. So that way you have both components. It's a smooth transition to get that certification over. A lot of the courses transfer. All you have to do is that course. So that is an option for the individual who's in the nursing education. I'm assuming they're in the nurse education program. Master's program right now. I would also encourage to attend some conferences, start networking, and make sure, do you want to be in the acute care setting or do you want to be in the academia setting? So there's two different ways of avenue that you can go there. It's just something that I kind of wanted to share. Sorry to butt in.
Awesome. I think that's a perfect stopping point here. I did want to give a big shout out to all of the panelists. Thank you so much for jumping in, sharing insight. Fantastic job. That was excellent. Also, big shout out to Lisa. Lisa, fantastic job moderating. We certainly appreciate it. This was fantastic. Like I said, this session was recorded, so we will be sharing this out because that was amazing. So I do thank everybody for jumping in. Another big shout out to our alumni liaison team here. That's how we were able to secure the panelists. So thank you for them for reaching out to you all, connecting separately. Really appreciate them sharing all of your contacts to come back and share some insight with WGU students and fellow alumni. But thank you again, everyone. Thank you, panelists. Thank you, Lisa, for jumping in. Fantastic job. And we'll certainly be sharing this out moving forward. Thank you, everyone.
Thank you for having
Thank
us. Thanks
you.
for everybody that joined.
Thank you very much.
Thank you. Good luck, Christy.
Yes, stay safe,
you.
Christy.
Yes, stay safe, Christy.
Yeah.
Thank you.
Take care.
All right. Thank you.